Hi, I'm Dr. Ashley Whitaker. I'm a pediatric neuropsychologist and division chief of neuropsychology at Phoenix Children's. Neuropsychology is focused on the connection between the physical brain and its functions. So things like thinking skills, attention, memory, things like sensory perception. So how the brain processes and perceives auditory, visual, tactile information. Basically anything that the brain can do, that functional piece, that's what we're looking at. Neuropsychology plays a different role depending on the diagnosis. For cases like pre-surgical epilepsy, we will be involved from the very beginning. We want to get a baseline evaluation to see where that child's strengths and weaknesses are. The first time we test them, we're in a room one-to-one. We get to know them. They get to know us. They get to know what we're asking them to do, and we can prep them each step of the way. So for some patients who are being considered for epilepsy surgery, they will undergo a functional magnetic resonance imaging test, which is an fMRI. The patient goes into the MRI machine and the radiologists are there, they're running the magnet, they're capturing all the images to try to figure out what pieces, what parts of the brain are activating, and the neuropsychologist is there testing the child. It's really helpful for us to be in the OR because when they wake up, it's scary. They look around and they recognize us. We might look a little different, we've got the scrubs on, scrub caps, but they know us and we've been practicing this and we've been preparing for this. Neuropsychology is not only involved in the initial planning and surgical process. We follow them for years after. We want to continue to follow them and evaluate them as their brains continue to develop. We might help with school reintegration, helping to guide the plan. And then from there, as their brain's developing, we continue to evaluate them. We continue to adjust the different recommendations because what's helpful for a 6-year-old is very different than what's helpful for a 15-year-old, which is different than what's helpful for a 21-year-old. At Phoenix Children's, we're not just treating the condition, we're treating the patient. And we want them to have a fulfilling life.